in preparation for surgery, I think that one of the biggest components is to have a plan for how things are going to be after you come home. I think a lot of anxiety is centered around the unknowns. How am I going to feel? What's my pain going to be like after surgery? And we can give you a general idea of some of that, but we can't always predict it. So you should just have a comfortable plan knowing that at least for the first few days, maybe that first week, you have somebody who can check in on you, help out, especially if you have a lot of home responsibilities where there's younger children, there's things that you have to do around the home that might involve lifting or bending or twisting. A lot of the things we're going to tell you not to do after surgery. Now, often you will have a preoperative visit with your surgeon a few days before the surgery, and you should use this opportunity to ask any last-minute questions that you have to make yourself feel less anxious about the surgery. No question is silly or stupid. Ask anything, because everybody's situation is a little different, and there may be factors that are specific to you or your home situation that you're worried about, and hopefully that's stuff that we can answer and make you feel better about. Usually we will have you also stop some medications, particularly blood-thinning medications, before surgery. Depending on what those medicines are, it may be that you need to stop them for a week prior to surgery. Some medicines you might have to stop a few days before surgery. And this is something that you should ask your doctor if you're not sure. You should bring it up. For some patients, especially guys, we may ask you to shave the night before surgery. If it's a cervical disc replacement, I want to make sure that the skin is prepped and clean. If you have a beard, you need to shave it. And I've had many patients look at me very unhappily when I've told them that they have to shave their beard so that we can access the surgery site in their neck and, not have to use the clippers on the day of surgery. So these are some things that probably patients wouldn't really think about, but definitely impact the actual surgical procedure. I think that one of the other common things that comes up is after surgery, having narcotics on board, it's going to slow down the GI system. There's going to be constipation, and for some patients, that's a really big concern and sometimes can be a little bit problematic. We encourage you to go ahead and have some stool softeners at your home, maybe have some things that are a little stronger just in case the narcotics really cause you not to be able to use the restroom. And again, just prepare for this. Know that this is something that happens when you take narcotics, and it's something that with appropriate medications you should be able to get through. I think that just having your mind right and feeling confident that you've made the right decision and that you feel confident in your surgeon, even though you're going to be a little nervous about the surgery, overall you should look at this as the beginning of getting back to the life that you're really hoping for.